Justine Pogorzelski, and with me today is Democratic Congressman Brendan Boyle, who represents the 13th District, which includes areas of Philadelphia and the suburbs of eastern Pennsylvania. Congressman Boyle is a member of the House Committee on the Budget and also serves on several caucuses that are devoted to healthcare issues. Welcome, Congressman Boyle.
Thank you. It's great to be on your program.
I'm happy to have you.
And a very important topic.
Yeah. So my first question to you is, could you explain to our audience the various legislative processes that goes into changing our current healthcare policies through Congress?
Yeah, well, first, just to set the stage, probably of all the domestic issues, so not including foreign policy, but of all the domestic policy issues, healthcare is the most complex, by far. It is something that our country has been grappling with for the better part of a century. It's something that I think that as a society, if you compare us to other industrialized countries, we don't exactly stack up very well. When you consider that we pay about 17% of our GDP in healthcare costs, that's almost double what other Western industrialized countries spend, like Germany, France, the UK, Canada. Some have more public systems, some have more hybrid systems, but for each and every one of them, they spend far less of their GDP on healthcare than we do. And at the same time, our healthcare outcomes are not superior, despite the fact that we pay so much more. So for all the time and attention that healthcare has gotten, unfortunately, I would argue that we don't have much to show for it. Now, ever since the end of World War II, there has been an effort to attempt to create some sort of public insurance system. That's when a lot of other countries, such as the UK and Canada, created their own healthcare system. In the United States, for various reasons, that was defeated. In the 1960s, around 1965, Medicare and Medicaid were created, so at least we had health insurance for older people and the elderly. Medicaid was initially for lower-income people, but Medicaid today is actually much more complex than that. Given that you're studying this, I know I'm telling you something you already know, but for many people in our society, they probably still have the connotation that Medicaid is much more simplistic than it actually is. If you have an older person in your family who's in a retirement home, they're probably receiving the benefits of Medicaid, and that is a big percentage of our Medicaid budget. So fast forward to around 2009, 2010, Barack Obama was elected president in 2008. Democratic Congress wanted to push to try to solve this problem where, at that point, we had as many as 50 million Americans lacking health insurance. So the idea behind the Affordable Care Act was to attempt to pull people together through a series of taxes and tax credits, get people able to buy into exchanges. And that, in my view, has worked to, at the very least, bring down the number of uninsured to a record low level. More than 20 million Americans have their health insurance today because of those exchanges. The big fight in Congress for the last 2 years was whether or not we were going to turn back the clock and eliminate the Affordable Care Act and replace it with something else. And I'm very happy that the Affordable Care Act stayed, that more than 20 million Americans were able to keep the health insurance that they had. There are some changes that I would like to see. Maybe we'll get a chance to discuss. That said, turning the clock back and either getting rid of the Affordable Care Act, getting rid of the exchanges, or privatizing Medicare, or getting rid of Medicaid, I don't think those are the directions in which we need to go as a society. It's a very politically charged debate. In many ways, it has to do with what you believe what you think the role of government is. I believe that it is appropriate and right for government to be involved in things like Medicare and Medicaid. Left to its own devices, left to a purely free market, we had tens of millions of people who lacked insurance. It's the reason why Medicare and Medicaid and the Affordable Care Act were created in the first place. And I think it's far better to build upon those successes rather than those who just want to dismantle the system and repeal it. Final thing I'll say is that this is really one of the biggest debates as a society that we have. It was controversial in the late 1940s when Harry Truman first pushed for a universal health care system. It was controversial in the 60s when Presidents Kennedy and Lyndon Johnson pushed for Medicare and Medicaid. It was controversial in the early 90s when Bill Clinton took office, controversial 10 years ago, and remains controversial today. But I continue to believe that government involvement in healthcare is absolutely warranted if we're going to finally get to the point of universal coverage and bring down our exorbitant healthcare costs.
Okay, thank you. My next question for you is, what do you think could be improved in providing better healthcare delivery to the American patient, and how is Congress addressing those initiatives?
Well, one of the things that was talked about a lot 10 years ago and still is today, this fee-for-service model as opposed to fee-for-outcome.
Right.
One of the things that was in the Affordable Care Act that probably got, I wasn't in Congress at the time, by the way, but as someone who's very interested in the subject and was following the debate, and obviously has had to work on it for the last 4 years as a member of Congress, one of the things that was less talked about in the Affordable Care Act were incentives to try to move the system along to fee-for-outcome as opposed to just fee-for-service. That's clearly, while it's easier said than done, that is clearly more the direction in which we need to move. One of the frustrations that I've had, especially since, to be candid, Republicans had full control of Congress and the executive branch for the last 2 years, was that for political reasons, so many were insistent upon repealing the Affordable Care Act. And that took up, the better part of a number of years. Instead of saying, okay, look, we've had the Affordable Care Act, we've had it for about 9 years now. It has done many good things, but like any piece of legislation, it's not perfect. What are ways that we can build upon that success? What are ways that we can learn from it? What are ways together we can figure out how to grapple with this uniquely American problem of incredibly expensive healthcare costs for outcomes that don't match the dollars that we're spending? Why don't we work together, recognize that the Affordable Care Act is here to stay, that is a certain foundation for dealing with the problem of millions of uninsured, and let's figure out ways that we can work together on the cost issue. So that's something that I'm interested in. I'm actually a co-sponsor of legislation with individual Republican members to try to move on from this debate, because I think in many ways we've wasted the last several years in not solving this problem, bogged down in this political debate because certain folks in the other party wanted to fulfill a campaign promise that they've been making for a number of years. One other point I want to make on this that's very important. I mentioned that about 17% of our GDP is spent on healthcare costs. That is projected to grow. By some projections, it will be above 20%, not too long from now. If that's the case, that will crowd out so much of our other spending. For Medicare, for Medicaid, there's a theory that some economists have when they look at our economy over the last 20 years and they wonder why hasn't payroll increases gone in hand with the improvement in our employment situation. A number of economists on both the left and the right theorize that the increased cost of healthcare has crowded out what for past generations was increases in your paycheck. So it shows you that as a society, if we don't deal with this spiraling healthcare cost issue, it's going to lead to so many other problems that it's in our best interest to come together, whether Democrat or Republican, and work on strategies to solve the cost issue.
That was really eloquently said. That was
Thank you.
interesting as well.
Thank you.
Lastly, in your opinion, what's the greatest challenge for Congress in making healthcare policy? And what's tough about making it accepted by all members, including the patient, providers, and insurance?
Well, I think this is part of human nature. There's always a great resistance to change. So any change, even if it's clearly in the best interests of folks. But to do the first part of your question, in terms of the political process, I studied for my graduate degree in public policy. I very much believe in studying these issues, whether it's in healthcare administration or broader public policy. But then, unfortunately, the politics interferes with, the cost-benefit analysis, and that's always a great frustration. I mean, I literally pointed to the fact that because that repeal and replace mantra on the right had been so big, there were a number of members of colleagues of mine on the other side of the aisle that felt they had to push through with that, even as it became less popular. But they felt that they were tied into it. So politics ends up driving more of these decisions than it really should. And I think now the Democrats have taken back the House, but we still have a narrowly Republican Senate and a Republican White House. It might be an opportunity for a sort of reset to recognize that the Affordable Care Act isn't going away. It's clearly, the repeal effort is dead. Politically, it was a big loser for the Republican side this past election. So maybe now that's an opportunity for them to kind of move off of that and work with members on the other side of the aisle who sincerely want to try to figure out ways to bring down healthcare costs. So I will say, on an optimistic note, I think that there's an opportunity now to move on from what has been kind of the stale, tired debate of the last decade, and talk about ways in which we can make insurance more affordable. Talk about ways, and it hasn't come up specifically here, but our prescription drug costs. While on the one hand, it's wonderful the way these research and development companies have come up with medicines that didn't exist 40, 50 years ago, in many ways it has turned to prescription drug-based. At the same time, when we're dealing with prescription drug costs that are so expensive, it is an enormous problem for our society. We haven't had the opportunity really to grapple with that because we've been bogged down by this repeal and replace effort. So my hope is that now it's a chance to be able to move on from the question about the survivability of the Affordable Care Act, and instead be able to move on to the cost issues and some other parts of the debate.
On a lighter note, do you have any advice to our healthcare administrator viewers who are watching?
No, that would probably be helpful, but sorry, I don't have any advice. No, just I'm glad that I give Arcadia a great deal of credit for having such a program. Certainly very unique in higher education. Healthcare continues to be incredibly important. It will continue to be a large part of our GDP. So I think in terms of choosing a career path, anyone who chose this path was pretty smart, because I certainly think that there'll be future employment. What I would say is that I'm someone who believes that, look, we have a crazy political system sometimes, and the rhetoric can become very heated, and a lot of attention is focused on that. But then off the front pages and away from the TV cameras, a lot of good substantive work happens. And so I would encourage people who are studying this academically to please continue to do so and to use what they've learned to help be part of crafting a solution. Because, and again, this doesn't get a lot of attention, but whenever I deal with, say, CMS, or whenever I deal with those who are in healthcare, there are a lot of committed, bright folks who are really trying to solve this problem and to fix this system. And that probably doesn't get as much attention as it deserves. So there's a real opportunity for folks who are studying this to finally be part of the generation that gets it right for our country and healthcare.
Great. Thank you so much for your time. I appreciate it.
All right. Thank you.